Okay, Sam, thank you. This week marks World Breastfeeding Week, but there is new concern with the Delta variant and so many questions about new moms who've had COVID and are breastfeeding. Here to shed light and dispel myths, Dr. AnnMarie Golioto, part of the Hartford Healthcare and Connecticut Children's Pediatric Care Alliance. Thanks so much for joining us.
Thank you for having me today.
So let's start with talking, what is World Breastfeeding Week?
So World Breastfeeding Week is celebrated every year from August 1st to August 7th and actually started back in 1992. It's really a celebration across the whole globe to raise awareness and galvanize support for breastfeeding around the world. And it celebrates a different theme every year to let us know what we should be focusing on.
There are lots of questions right now about COVID, the vaccine, and breastfeeding. What is your best advice for new moms?
Well, what I will say is that we know that the COVID vaccine is safe. It has been given to millions of people across the world and certainly in the United States. And recently, the American College of Obstetrics and Gynecology has come out in support of vaccines for both pregnant women and for women that are breastfeeding. As a pediatrician, I support that as well. And we do have children under the age of 12 that cannot be vaccinated right now. And the best way to support them and protect them from getting COVID is to have as many people around them vaccinated that can do so.
And as we talk about our younger children, and especially babies, if you are breastfeeding, is it possible that a mom could potentially transmit the antibodies through breastfeeding to better protect her child?
Yes, that's what we hope. So when we get a vaccine, our body makes an antibody to what that vaccine is trying to prevent. Those antibodies are passed through the placenta to a mom, from a mom that's pregnant to her baby, and our hope is that it's passed through the breast milk to protect her baby while that baby is too young to be vaccinated.
You talked about it every year, a different theme. What's the theme this year?
So this year, the theme surrounds protecting breastfeeding and that it's a shared responsibility. That really comes into play with our Pediatric Care Alliance in Hartford Healthcare and Connecticut Children's. So we have partnered together to provide pediatric care from birth through adulthood by using all of our facilities together to bring the best care we can to these children up until the age that they no longer need pediatric care. So we all partner together from prenatal care to obstetric care during pregnancy, delivery, and afterwards to make sure that we're providing that best breastfeeding support to those babies and moms.
And real quick before we let you go, why is supporting breastfeeding so important for all of our viewers watching?
Well, it's not just important for that individual mother and baby, but it's really important for the entire world. Breastfeeding helps sustain and is one of the goals from the United Nations. We really want to decrease infections overall and promote health. And we really know that providing breast milk supports our youngest babies, our babies in the NICU, and keeping them healthy, as well as decreasing the risks of infections throughout life and even cancers for mothers as they age.
Dr. AnnMarie, thank you so much for joining us today.
Thank you.
Okay, we'll be right back after this.